Hello, my name is Scott Langston, and welcome to this series of short videos about different therapeutic modalities. Today I'm going to talk to you about psychodynamic therapy and what it is, how it works, and how it's useful with working with clients. So, first of all, psychodynamic therapy is one of the oldest, one of the most influential forms of psychological treatment. It looks very different from the early psychoanalysis. You may have visions of Freud with his noteboard sitting behind a patient who's lying on a couch. That is not what we do in psychodynamic therapy. But it shares the goal of helping people understand that unconscious patterns do shape their emotions, their beliefs, and their relationships. So, what I hope to do today is explain how the process works. So it's based on the idea that our present day thoughts, feelings, and behaviors are very strongly influenced by unconscious processes, patterns that were formed through early life experiences and relationships and unmet emotional needs. These patterns often operate outside of our awareness, but they can affect how we view ourselves, how we choose partners and friends, how we react emotionally to situations, and the defenses that we use to manage stress and discomfort. They're also closely linked to our capacity for intimacy and for trust and for self worth. So, psychodynamic therapy helps to bring these hidden patterns to light so that people can understand them, work through them, and ultimately experience more freedom and more choice in their day to day lives. So, as I've said, psychodynamic therapy does come from the work of Sigmund Freud, but today's approaches are more modern, collaborative, and they are grounded in decades of research. Some of the most important developments include object relations theory, which focuses on how our earliest caregiving relationships form our personality. Attachment theory, which explains how our early bonds influence how we relate to other people, our emotional bonds across our lifetime. Ego psychology, so focusing on our strengths, our coping, and our adaptive functioning. And rational psychotherapy, emphasizing the power of the therapist-client relationship. So there are some core principles involved in psychodynamic therapy. We've referred to unconscious processes. So much of what happens automatically and outside of our conscious awareness. And our therapy aims to bring the unconscious into consciousness. We all have defense mechanisms, the emotional strategies that we use to protect ourselves from pain, discomfort, anxiety. Um, and these are such things as denial, refusing to accept a situation, projection, attributing our own feelings to somebody else, intellectualization or rationalization, understanding facts rather than just feeling and sitting with feelings, and humor, using comedy to divert, to avoid vulnerability. None of these defense mechanisms is bad because they're simply coping mechanisms. But therapy helps people understand which ones are helpful and which forms of defense are less helpful and limiting. Our childhood experiences what shape our expectations of relationships, our sense of safety, and of self worth. So, exploring the origins of those feelings helps people understand what they're currently struggling with. And the therapeutic relationship or the working alliance, which is the relationship between the therapist and the client. Patterns learned in early life will replay in adult relationships, the therapist client relationship included. This is known as transference. And if we can explore these patterns in therapy, then they can become a powerful source of insight and healing. So, psychodynamic therapy works through free association, encouraging the client to speak freely without censoring thoughts to uncover deeper layers of meaning and feeling. Interpretation, which is the role of the therapist to gently connect patterns and themes and emotional links that the client might not see, a case of not seeing the wood for the trees. Exploration of emotions, so we focus on understanding, not suppressing emotions, especially ones which have been avoided or within society carry stigma or shame. We examine patterns in relationships. Current relationship difficulties are explored, trying to uncover longer term emotional themes. We try to understand the past in the context of the present and vice versa. Our early experiences shape our current reactions, and our current reactions can be explained by some of our early experiences. And we work through these things. We don't just understand them intellectually, we revisit them many times in different forms, feel them and connect with them until they genuinely change. A big part of psychodynamic therapy is insight, a deep understanding of self. We recognize emotional triggers, we understand why certain patterns repeat. We aim to reduce self-criticism and to improve the relationships that we have. And then we're making choices based on awareness rather than choices based on habit. So the insight that we come to through psychodynamic therapy can provide long and lasting change. Psychodynamic therapy can be either short or long term. By short term, not as short as things like CBT or SFT, but something that would play out within a 6-month period, maybe 16 to 25, 30 sessions. And it might focus on one particular pattern of behavior or one particular issue. Long-term psychodynamic therapy, much like psychoanalysis that preceded it, can continue for years. So typically a session of psychodynamic therapy would include reflection on recent interactions and emotional experiences. It would involve exploring and noticing themes. It might explore dreams and fantasies or imagery. It would seek to understand defenses as they arise. We would be examining the emotional reaction to the therapeutic process and to the therapist. And we'd be seeking to make those links between current struggles and earlier experiences. Psychodynamic therapy has been shown to be effective in reducing symptoms of anxiety and depression, in improved self esteem, in healthier relationships, in greater emotional stability all around, and in long lasting change even after therapy ends. So, the core message of psychodynamic therapy is that by understanding deeper patterns that shape our emotions and relationships, we gain the freedom to live with greater authenticity, connection, and emotional clarity. It's a journey inward toward insight, healing, and an integrated sense of self. And thank you once again for joining me for this brief explanation of psychodynamic therapy. Please feel free to like and to subscribe below and check back for other videos along the same theme, exploring things like CBT, SFT, DBT, all the acronyms. The last video in this series is going to be about IFS, internal family systems.